procedure, I'm going to do the home visit performing the bag technique. So first we now proceed to the assessment. In the assessment, we gather all the equipments needed, the pitch and bag and its contents, and the other paraphernalia for home visit, like the sage and logbook. And then we need to gather all the necessary information of the family from the RHU family folder or the other member of the health team who handled the client. And then we now look upon locating before performing this procedure, we need to introduce ourselves first and explain to the client what we are going to do, so that they will have knowledge about the procedure. So, and it is important that we need to greet them, to pay respects, and they won't be in shock when we proceed. So next, after that, we now observe the client and provide the health needs of the client. So the purpose of this is that we are going to monitor, or we are going to know if the client is capable, and if there is any intervention in his or her health, we prevent it. We can also educate them about what is the about the simple procedure when in case of emergency, like that. And then for them to know, to determine their own health needs. That's why we are going to do this procedure. And after that, we now proceed to providing them privacy. And then we proceed to the planning. So in the planning, we formulate our nursing objective for this home visit. And in planning home visit, consider and give priority to the essential and recognized needs that we recognize the needs of that individual or the family, and we plan to deliver our best care, and that that involve the individual or the whole family. And in planning, we need to be more flexible. Implementation first is when arriving to the client's home, we need to take out our paper lining and put it under the table, and place the bag to that table with a flat surface, and then clean our we should have a clean environment when doing this procedure. And then we need to ask for basin of water or dripper of water if the faucet is not available, and place them outside the working area. So let's assume that I did that procedure, and then we now open the bag. So in opening the bag, we take out the hand towel. So in opening the bag, we now take out the hand towel and the soap dish and the apron, and place them into the corner. And then after that, I will now close the bag and do hand washing.
So in doing the hand washing, we need a use soap, or if they have use soap that is should be clean, then we can use it. So now we will teach also when performing the hand washing, we also teach them on how to do the proper hand washing. So apply soap to the hand. In doing hand washing, we advocate them so that there would be no after doing hand washing, we pat our hands into a clean towel. After doing the hand washing, we now put the apron right side out and wrong side in the crease touching the body, sliding the head into the neck strap and neatly tie the strap at the back. So now we put out all the things. Most needed in the specific case in our visit. For example, we have the pregnant client, postpartum mother and the newborn, and school age child, morbid case, and they are your family caseload, etc. We need thermometer, kidney basin, cotton ball, waste paper bag, and BP apparatus, etc. and placed in one corner in the working area with a plastic or paper. So after putting the apron, we need to take out all the materials needed, but it is also based on what is the situation of the client. For example, she's pregnant, then we do that situation. But for me, I'm going to use, for example, if there is any emergency, if for example the child is cause emergency, then I will teach them a basic step on how to prevent any infection. So we need cotton ball, we need the alcohol with the gauze and the hydrogen peroxide, and we can use forceps. So since I don't have any plastic here, then I am going to use the paper. For me to garbage all the used materials. Okay, and then close the bag. Next, we place the paper bag here, and then we proceed to the specific nursing care or treatment. So, there. So for example, already done taking care of the client, then the used materials will be put here in the paper bag, and after that we now do the hand washing again so that we can't be exposed to any other infection. And then we now put all the things inside the bag to their proper places. So next is, after putting them inside the bag, we now take the apron and place it to the plastic bag and put it inside the PHN bag. So, okay. And then after that, we make after we do the procedure, we now make the post-visit conference on matters relevant to their healthcare. So we revisit, and then if there's any changes or if there is any problem, we will document it to our anecdotal note to the CHN logbook. And then we take also we also take notes for the environmental factors which affects the family's health. So we will educate them the proper environment, the proper clean environment for them to have the better health. And then make an appointment to the next visit. It's either the home or we let them visit the clinic. And do a aftercare by keeping the area clean and return all the used materials we used a while ago. Now, we proceed to the evaluation. In the evaluation, we record and document all the findings during our visit about the health of the family, and then we include the quality nursing care, nursing-patient relationship, and document all the nursing care rendered and evaluated the effectiveness of nursing care provided. And also we refer them to the RHU if there is any aberration from the normal findings. Thank you.